Giardia is a microscopic intestinal parasite that causes diarrhea, vomiting, and weight loss in dogs. It is one of the most common parasitic infections in puppies and spreads through contaminated water, soil, or surfaces. For breeders, a Giardia outbreak can spread rapidly through a litter and become a recurring nightmare if not addressed properly. In this video, we'll cover everything you need to know about preventing, diagnosing, treating, and eliminating Giardia from your breeding facility. Giardia is transmitted through the fecal-oral route. Puppies get infected by drinking contaminated water from puddles, streams, or shared bowls, by licking contaminated surfaces, grass, or soil, through contact with infected feces from other dogs or wildlife, and by grooming themselves or litter mates after exposure. Giardia cysts are extremely hardy. They can survive for weeks to months in cool, moist environments, making kennels, yards, and whelping areas particularly vulnerable. Symptoms range from mild to severe. Watch for soft, watery, or mucus-coated diarrhea, sometimes with a greenish tint. Foul-smelling stool, vomiting, decreased appetite and lethargy, weight loss or failure to thrive, and dehydration, which is especially dangerous in young puppies. Some dogs carry Giardia without showing any symptoms, which is why routine testing is so important, especially before puppies go to new homes. Giardia is diagnosed through fecal testing. Fecal flotation identifies cysts in a stool sample but can produce false negatives because cysts are shed intermittently. The Giardia SNAP test is more reliable and detects antigens even when cysts aren't being actively shed. PCR testing is the most sensitive option and detects Giardia DNA directly. Because shedding is intermittent, a single negative test does not guarantee the dog is clear. If symptoms persist, test again or request a more sensitive method. The standard treatment includes Fenbendazole, also known as Panacur, administered orally for 3 to 5 consecutive days. It's the most common treatment and is safe for puppies. Metronidazole, known as Flagyl, is sometimes combined with Fenbendazole for stubborn infections. Many vets recommend a combination protocol. Fenbendazole for 5 days with Metronidazole for 5 to 7 days, followed by retesting 2 to 3 weeks later. And this is critical. Treat all dogs in the household simultaneously, even those not showing symptoms. Untreated carriers will reinfect treated dogs. Treating the dogs alone is not enough. Giardia cysts in the environment will cause reinfection. For indoor surfaces, remove all fecal matter immediately. Clean with a quaternary ammonium disinfectant like Rescue or Axel. Steam clean floors, crates, and whelping boxes. Since Giardia dies at temperatures above 158 degrees Fahrenheit, wash all bedding in hot water and dry on high heat, and disinfect food and water bowls daily. For outdoor areas, pick up feces immediately. Limit access to muddy or shaded areas. Allow sun exposure since UV light reduces cyst viability. Pressure wash concrete areas with quaternary ammonium solution and rotate grass access areas since grass is the hardest to decontaminate. And do not skip the bath. Bathe all dogs on the last day of treatment to remove cysts from the coat, especially the hindquarters and paws. This step is often overlooked and is a common reason for reinfection. Prevention is far easier than fighting an active outbreak. For water management, provide fresh, clean water at all times. Change bowls multiple times per day. Use elevated or spill-proof bowls, and never let dogs drink from puddles or shared outdoor sources. For sanitation, clean whelping areas daily. Remove feces from yards immediately. Disinfect with quaternary ammonium products because bleach does not work against Giardia. And rotate puppies through clean play areas. Quarantine any new dog for at least 14 days and test them before introducing them to your pack. And for routine testing, test puppies at their first vet visit and again before going to new homes. Test adults at least twice per year, and test any dog showing soft stool. Here are the biggest mistakes breeders make with Giardia. Relying on bleach, which is not effective against Giardia cysts. Treating only symptomatic dogs while asymptomatic carriers reinfect the group. Skipping the bath after treatment, allowing cysts on the coat to restart the cycle. Not retesting 2 to 3 weeks after treatment. And ignoring the environment, because if you treat the dogs but not the space, the cycle continues. Giardia is one of the most common challenges breeders face, but it is completely preventable and treatable with the right approach. Consistent sanitation, clean water management, routine testing, and a thorough treatment protocol will keep your litters healthy and your buyers confident. Document everything from test results to treatment dates, so you have a complete record for every puppy. If you need a system to track health records, treatments, and share them with buyers through a pet portal, visit BreederCloudPro.com. Link in the description.